Good morning, Marina. How are you today?
Good morning, doctor. I'm good. How are you?
Great. Did you have any trouble getting here today?
No, it was good this time. No traffic. I got here on time.
That's good to hear. You know, you never know what you're going to run into here in Southern California. I just wanted to review some of the things that we found last time when you came in for your initial exam. So today we're going to be going over those findings and just discuss with you what different treatment options there are. Before we get going, do you have any questions for me?
No.
Okay. Well, that's good to hear. But just to let you know, as we progress through here, our discussion today, if you have any questions, just stop me at any time. Okay.
Okay.
We're going to be reviewing several treatment plan options to address your needs and you know, some of the goals that you had for your mouth and just ways to fix your teeth. And so you had mentioned last time that you really just wanted to get back to normal dental visits and get your mouth where it needed to be, and you also had a tooth that was missing that you wanted to replace.
Yes.
Is that everything that you were thinking about, and is there anything else that you maybe didn't mention last time that you thought about since then?
No, that's it. I just want to have healthy mouth and replace that missing tooth because it gives me low self-esteem and.
I understand. Well, you know, that's I being a dentist, you know, I see how much of a difference being able to do those things and get your mouth healthy and replace teeth really can make in someone's life. So anyway, just as we move on, I wanted to let you know that we're going to present the different options to you, and then at the end we'll go over the fees associated with the different treatment plans and address any questions or concerns that you have at that time. Okay?
Okay.
Well, just to begin with, reviewing some of the findings that we saw when we took a look in your mouth, there was some general inflammation and redness in your mouth, and after looking at the x-rays, we saw that there was some mild to moderate bone loss, and what that means is that you have periodontal disease, and I know that sounds you know, pretty ominous whenever you say you have disease, but really it's more a matter of bacteria, and it's something that we can manage, you and I together, along with the hygienist. We can manage that and get it under control, and it's not something, if you do what you need to do and what you wanted to do in your goals, it's something that you can definitely manage and live with, and you know, it shouldn't impact your life long term, as long as we really you know, take care of things right now. Okay.
Good.
All right. Some treatments that need to be done. First of which is a deep cleaning, and we refer to that as a scaling and root planing, but it's essentially a deep cleaning. The hygienist actually does this, and they come in and they basically they remove a lot of the bacteria and you know, just kind of the crud that you get on your teeth. They really just make sure that they get down in the pockets and things around your teeth.
Does it hurt?
It can be painful at times, but when we do this, you actually are anesthetized, so you don't feel that part of it. Just in case it is, you know, a little bit more uncomfortable than you might be used to with a typical cleaning. So, but that is something that we need to do as soon as possible. If you have time today, we may be able to get you in to see the hygienist. If not, we can reschedule you at another date. But once we get that done, then it's kind of a starting point for us where we can assess where we're going and give your mouth time to you know, heal and really see what we're really dealing with. Because until we get the inflammation down and get the bacteria under control, we really aren't going to know how your mouth is going to respond to the treatments that we provide. Okay. So, with that in mind, we'll do that, and there were a couple of other things that we noticed in your exam last time. One of which was that you had a tooth that had previously had a root canal, and I think you mentioned that in your exam when you came in last time, that you had some pain and you had seen a dentist, and they had removed the nerve for you and got you out of pain, but that they weren't able to complete treatment. Is that correct?
Yes, it hurt a lot, so I had to go, and they just took care of the pain, but that was it.
Okay. Well, that's fine, but what we need to do from this point moving forward is we need to take a look at that tooth again and make sure that all the bacteria was indeed removed by the previous dentist, and then we need to once we get rid of the bacteria, we need to fill the tooth again, and then we'll put a crown on top of it to restore you so that you can use it in normal function and chewing and things like that, and it doesn't look off color. You had a temporary in there that was a little bit more yellow than you're used to, but when we replace the crown on that tooth, it will be a better match with the surrounding teeth. Okay.
Good.
Okay. So once we've fixed that, you had several cavities in your mouth, and those are just in between each teeth. Sometimes you get some food and other things that get trapped, and the bacteria that live in your mouth all of the time. They really thrive off of a lot of that sugar and other things, and it's the acid that when your mouth it becomes acidic when you drink soda and other things. But it's at that point when these bacteria they really start to cause damage to the teeth, and so you have had some damage that we need to address and to fix. And once we do that, we'll do that following the initiation of your root canal, and then we'll do this within about a 4 to 5 week period, starting from whenever we begin your deep cleaning. 6 weeks after that, so in a 6 week window, we will have started your cleaning. We'll finish your root canal. We will fix the cavities that you have. And then we'll have you back 6 weeks later and reevaluate and see what's going on in your mouth and see if we've seen any improvements. And if we have, and of course this depends on you being able to stay up on your hygiene and clean your teeth, floss and mouthwash and all of that. We expect to see some improvement, and if that's the case, then we can move on to some more definitive treatment, which would be the permanent crown on your tooth that you had your nerve removed from, as well as being able to come up with different options to replace the tooth on your upper jaw that was missing. Okay. So, any questions so far? Is that all making sense to you?
It is.
Okay.
It is. So you said we'll finish it within 6 weeks?
We'll get to that point within 6 weeks where we can then start putting some of these more permanent restorations in, such as the crown and with your missing tooth. There's a couple of options that are there, and I'll just start running through them with the most ideal first, and that would be we'd like to place an implant, or it's basically something permanent that sits in your bone and simulates your root, like your original tooth. The root kind of sat in the bone, and the implant does the same thing, and then we just put another crown on top of it. And it depends on actually your bone level, but that's something that we'll be able to assess after that 6 week period, and see if that will work. But that's the most ideal. The next would be some type of a crown or a bridge, but it really is secondary. If we can restore that tooth without putting other strain or stress on any of the adjacent teeth, that's the most ideal. So basically for a lot of people, what it comes down to is cost, and so we've done this treatment plan with the most ideal, and it's going to cost approximately $5,000, and we can go to the front and get a breakdown of the prices. How does that fit into your budget and your timetable?
The timetable is perfect because I'm in summer break now.
Okay.
The money, I've actually been saving some money because I really wanted to get this tooth restored and get my mouth in good health. So the money sounds okay too. Plus I have dental insurance now, and I think it will help out.
Great.
I'm excited to just start the treatment. And
that's excellent.
Whatever is needed from me, I'll just do it. I'll be on top of my oral hygiene, and
Excellent. Well, that's great to hear. I really am excited to start moving forward with this treatment with you. I know that it'll make a big difference, and as you said, it'll help you start to anything that we can do to help people smile more is what we want to do. So, with that, just wanted to make sure that you didn't have any other further questions or concerns or anything.
No, you were really good at explaining everything.
Okay. With that, we'll go walk to the front and see what works with your schedule as far as booking an appointment to come in and get your deep cleaning started, and we'll move from there. So let's just follow me, and we'll go up and talk to the receptionist up front. Okay.
Thank you so much.